Today, I am excited to welcome Laurel Domanski Diaz, Cuyahoga County's Justice and Health Equity Officer. In this role, Laurel spearheads initiatives aimed at addressing disparities in access to justice and healthcare services, including a direct role in the creation of the county's Central Services Campus, new jail campus in Garfield Heights. Through strategic partnerships and innovative approaches, this role will work to dismantle systemic barriers and promote fairness, dignity, and wellness for all residents of Cuyahoga County. Laurel found her passion for health equity early in her life during an alternative spring break trip to Haiti, where she saw firsthand the impact of disparities in access to healthcare. As she learned more about the problems of the U.S. healthcare system, as well as her experiences volunteering during college at the Montgomery County Jail, her commitment to social justice deepened. Laurel has now spent more than 20 years working in safety net healthcare operations. That includes experiences at the Free Medical Clinic of Greater Cleveland, now Circle Health Services, and Neighborhood Family Practice. Her most immediate prior role before joining Cuyahoga County was the Administrator of Correctional Medicine for the Metro Health System. We are excited to learn from Laurel. Please welcome her.
Sorry, thank you so much, Rachel. I appreciate the this opportunity. And as I was saying to Rachel right before I got on the call, I'm just so excited that the Cleveland Leadership Center has an interest in this topic and a passion for it. This is something that's very close and near and dear to my heart, to work on the Justice and Health Equity program here in Cuyahoga County. This is something, as Rachel said, my career has really been spent working in this field and in this space. Early on at the Free Clinic and then at Neighborhood Family Practice, my commitment to community health and public health has been strong and going strong for 20 years. I also want to say hello to all of my friends and former colleagues on this call. It's so nice to feel so supported, and excited to see you all here this afternoon. I just want to give a little bit of background of how I came to this role, and then talk a little bit about the Central Services Campus and what we're looking for in the future here. So as Rachel mentioned, I had spent the last 5 years working for Metro Health and running the correctional medicine program in the Cuyahoga County Jail. And though that was probably one of the most challenging and exciting jobs that I've ever had, it also helped me realize the vast intersection between health disparities and the justice system, and how so many community members that we have end up involved in the justice system because of behavioral health or substance use disorder conditions. And so I think that when Executive Ronayne was thinking about how to do this jail, and he always says, I never wanted to be the executive that was known for building a new jail, but if I have to be known for that, I want to do this in a different way. I want to be a model that other communities and other jurisdictions and other states will come to look to see how to do this in a way that's more just, humane, and rehabilitative for folks. So when I met him, which was about 6 months, I had met him several times, but my most recent meeting of him before I'd taken this position was I was giving him a tour of our prenatal care unit in the facility in the Cuyahoga County Jail, and showing him how we had done a model program that really is unique throughout the country. We offer a centering pregnancy, or they still offer it. I'm not, obviously involved anymore, but a centering pregnancy program, which is a group prenatal care program. We offer nursing opportunities for women that have given birth to pump their breast milk and get their milk to their babies. And it's really a way, and Birthing Beautiful Communities is also involved and offers a doula program. And he was so impressed with that as a model program that we began to talk more about what other opportunities there might be within this system to really provide an experience and care that is different and unique. So when I took this position with him and with Cuyahoga County, really the goal is to blend those two efforts around health equity and around justice to create something that's different and unique. I'm going to hop over to some slides here so I can talk a little bit about the history of this program. Did you see my slides? Okay. Okay, so This really is a project that's been about 10 years in the making. It began in 2013 when the community recognized that the current facility, the current jail, was really not up to the kind of level of I guess, existence that we need to have in order to provide a humane experience for folks. So some of the issues with the current jail are that there are operational efficiencies just in the way it's built. The first tower, which you can see in the background of the picture to the right, was built in the 60s, and the second tower was built in the 90s. So it's an old facility, and it's a facility that's been used 24/7 for many, many years, and it's just not up to the, to the code that we would like it to be in terms of wanting to do the types of programming that we need. There's a lot of need to move people around the building. As I said, the physical condition is challenging. There are a lot of opportunities and a lot of places where you can do different things in a more modern facility. And so that's really what we're looking for as we think about this next phase in this next facility. So after the planning studies that were completed, there was strategies that were developed by the planning study committee to think about how to do primarily two things differently. One, manage the jail population differently, and two, the decision was made to relocate the jail to a new site. I'll talk a little bit more about the population management strategies in a moment when I talk about the vision and the goals for our project. So in March 2021, a public survey was completed, and this is just a word survey of all the things that people really wanted to see in a new facility and in a new space around this work. And I just want to point out that the humane living conditions was the primary driver for pursuing this project and pursuing this work. So since I've been here in the last few months, we really wanted to think about what the vision and the goal is for this project so that we can drive all of our design decisions, all of the programming decisions, and all of the work that we do around a kind of a centralized theme. So the vision is really to develop a humane, rehabilitative, and healing experience for all Cuyahoga County residents being held at the jail, and as equally important, disrupt the journey to jail for potential offenders. So what does that mean? The first goal is to reduce our jail population by ensuring that everybody that comes in there has been fully vetted for diversion or deflection efforts prior to incarceration. So again, that is going to look at the reasons why people are in jail, if we're talking about mental health and substance use disorder conditions, and if those conditions and the actions that might have caused them to be incarcerated because they were not well controlled, are there opportunities that we have in our community to divert them to other places, whether that's a current diversion center, whether it's a crisis center, whether it's other types of care, community-based behavioral health. Are there places and spaces that we have? And we know we do have some of those spaces in this community, but there are more that need to be developed so that we can get people to the appropriate care so they don't need to end up in jail, and primarily due to those conditions. The other piece with diversion and deflection is making sure that we're working with the courts, with law enforcement, and with other stakeholders to make sure that people aren't sitting in jail if they stole a candy bar at Walmart, or that if they did, or, if there was trespassing, or if there was a warrant that could somehow be resolved without them sitting in the facility. So we are working hard, and I'm working with some of my colleagues here at the county to make sure that we really boost those efforts and try to make some of these changes even prior to the facility opening. The second goal that we have is we want to ensure that residents' needs are met from a health, social, and rehabilitative perspective while held in the jail. So right now there is jail programming happening. Obviously there's a very strong correctional medicine program that happens that covers psychiatric and substance use disorder conditions as well. But we would like to see that programming expand. So we want to do vocational training. We want to do educational training. We want to be able to provide life skills, financial literacy, all the sorts of things that folks might need to help build up their skill sets so that they don't re-land into the jail. And then the final goal is really meeting the needs of returning citizens by ensuring that they have access to the resources that they need as they're exiting the facility. And so we're going to do that in a couple different ways. We want to have some programming, some immediate programming around reentry as they leave that may connect them to, to services, to transportation, to housing. But we also want to look at potentially having some more of like a community resource center on site where they could access benefits, where they could get an ID, where they could, might be able to get food resources. We really want to think differently and broadly about how, we look at what the resources people need so that they don't recidivate back into the jail. One of the things that we found when I was working in the facility was that there was a lot of need around housing, that 40% of the people that we were working with on a patient navigator program that we had in there had identified that they had unstable housing, whether it was due to homelessness or they needed a treatment level, housing facility. These are the things that we really need to think about as we build this new facility. But also as we're thinking about the next few years, what are the things that we can put in place even prior to the facility being opening so that we can start to, tick away at some of these goals. So that is the formal presentation that I have. I'm happy to entertain any questions or talk a little bit more.
Great, Laurel, let's jump into some questions. So you have spent so much of your time in healthcare settings. What drew you to this role working with the county?
Right, so in 2018, I'm sure those of you that have lived in Cleveland a while know that there was some pretty severe challenges that the jail facility faced in 2018. There were 8 deaths that occurred. Some of them were due to suicide. Some of them were due to drug addiction, either with overdoses and other complications of drug addiction. And so at the end of that year, beginning of 2019, Metro Health was approached by the county to take over that jail contract and to really right the ship around the provision of medical care in the facility. I had a conversation at that time with some Metro Health leadership that said, and they said to me, this is something that we need to do. Would this be something that you would be interested in? And I looked at it as the biggest social justice issue in our community at that time. And given my healthcare background, I said, absolutely, this is, I'm right on board. This fits with my passions. And again, I stepped into probably a fire hose of issues and problems, and really spent the next 6 months kind of revamping the entire operation along with my colleagues and a great team of caregivers that are still there in the facility and leadership at Bexar Health as well. It was, again, like I said, one of the most challenging things I've ever done. But I think that knowing that I stepped away 5 years later and that we really have truly made a difference and that folks in there are getting care. And I think the story that is often not heard is the amount of lives that are saved every day by people ending up in the jail. I have a whole host of stories of people that have come in, and had they not landed there and seen one of our providers and ended up, hospitalized or ended up in the emergency room because of the way that, we cared for them while they were there, I don't even want to, think about what would have happened to them.
And over the past few months since stepping into this role, what have been some of those first priorities you've tackled?
So we pretty quickly have worked on a few different things. One is that we really want to hear the voice of the community in this effort. It's one thing to sit in an office downtown on East 9th and try to decide what the best approaches and strategies around programming and effectiveness of a program. But really, it's a whole nother thing, and something that Executive Ronayne and myself are very committed to is speaking to people that have lived experience. So those that have either are involved with organizations that are either providing reentry services to returning residents, like an Edwin's, for example. I know you have Edwin's speaking next week, so it's a very timely conversation. But we actually, we went out there, we spoke to some of the folks that are involved in the Edwin's program, and we asked them, what was your experience in the jail? What would you like to see differently? Would culinary programming while you were there have made a difference in your life, or being connected to the program? So really, trying to understand from the community what the needs and the desires are around, creating this different vision has been a huge priority. We've also begun working with our architects and thinking about how do you create this building in a way that's going to make sense both for the community, but also for the staff and law enforcement and those folks that are going to be involved in the facility.
Can you offer some clarification as to the differences in a jail population versus a prison population and other levels of offense? And what is the average time spent in jail?
Sure. Yeah, so a jail is that's a really important clarification. I think that people don't really understand fully, and I'm not even sure that I really completely understood it fully until I started working in the space. So jail populations are confined but not convicted. So basically everybody that's in jail is waiting to either go to trial or have their judge decide whether they can, just be released on a bond, or whether their charges are being dropped. But nobody in there has actually been, well, that's not true. There are some people that are sentenced for, short periods of time, but the majority of people have not been actually convicted of a crime. So the other thing that's really fascinating about working in jail work is that you get everybody that you get is essentially coming straight off the street. So there's a lot of instability around, mental health and substance use and even medical conditions. A lot of people have not been, to see their provider, ever, or, recently. So there's a lot of stabilization that needs to be done from a health perspective, where once they transfer to prison, all of that work has been done. So the risk of, kind of adverse outcomes and adverse things happening is much greater when people are in a jail versus in a prison. And then you had asked, what was the second part of your question?
The average length of stay. How long might someone be there?
Yeah, so the average length of stay in our jail is about 30 days. We do have, another important note is that we are the county jail, but we are also the city of Cleveland jail. So the people that are coming from the city of Cleveland may rotate a lot quicker through, where the county folks are usually waiting for trial or have somewhat of a longer stay. So Cleveland folks might have a shorter stay. The county folks would generally have a longer stay. So that's kind of how we get to the average of 30 days.
There's a lot of conversation and opinions around location of jails. Can you share some insights into the decision behind choosing Garfield Heights and talk about the community input and reaction in that process?
Sure. So there were a few things that we were really looking for when that site was chosen, and I realized I didn't click through a couple of my slides that I wanted to talk about. But some of the priorities, besides the programming that we want to offer in the facility, is some priorities around making sure that the facility provides a lot of light, a lot of opportunities for air for people. You can see, those of you that have driven by the jail, the current jail, is that there really isn't any opportunity for people to have that right now. They can't get fresh air. They can't, there's very limited light opportunities. And we know that, from a mental health perspective, to have those things available to people so that they know, what time of day it is and what's happening, even outside of the cell walls, is really important for stability. So we wanted to find a space where we would have a lot of acreage to be able to kind of expand and create a facility that was not quite, kind of a stacked tower. So that was one of the priorities for moving, the jail outside of the facility, or outside of Cleveland. There really was not the opportunity for that type of acreage that was needed within the city of Cleveland proper. So that was really one of the primary reasons why that it was chosen to move out of the city.
And what conversations or what plans are there for the current site once the jail does move?
So I really can't speak to that. There are, there still will be the court. The courts are still there in the towers for now, but I don't really know what the plans are yet for that.
So let's talk about the programs. You mentioned the ideas around a lot of programs coming in and wraparound services. What level involvement will your role have in creating those diversion strategies, those programs and policies, and what is being worked on at this point?
So yes, that's a great question. My role is really as kind of a senior advisor to Executive Ronayne to make sure that the things that, the strategies and the ideas that are unique and are innovative around the country, that we're applying them as we can to this community. So I have two colleagues that I'm working very closely with, Brandy Carney and Naila Bird, on both of those strategies right now. So there is an existing diversion center in the city right now. Law enforcement really does not use it. So we are trying to think about how do we, engage them further, or is it a different model, or what are the things that we have to do to kind of help the community to adopt this idea of, instead of taking people to jail, let's take them to treatment. We've seen this work in many other communities. So it's just really kind of bringing people on board and bringing people around, into this community. And it may be a different model completely. We are talking through that right now. One of the pieces that we're talking about inside the facility around those same strategies is to have something that we've seen in Davidson County and Nashville, which is it's called a behavioral health care center. And so it's an alternative treatment facility that's, within the secure perimeter of the jail, but really is modeled more like a behavioral health hospital or an inpatient behavioral health unit, so that people can have the opportunity to heal, not in a jail cell, but rather in a more healing environment. And in terms of the, kind of the other diversion efforts around courts, that's really my colleague Naila Bird who's taking the lead on that. And we were just convening this morning around kind of re-energizing some thoughts with that around with the probation department and others. There are some really neat initiatives that are happening in Cleveland right now around bail reform. There's a couple different projects that are working in Cleveland. The Bail Project that actually provides bail funding for folks that qualify to get them out of jail. And then the Unbail Project, which is a app-based system that helps people that are released get reminders around court dates and things like that. So there's a lot of good work happening. I think one of the important pieces of my role is really kind of pulling all those thoughts and strategies together, seeing what is going to be effective, and trying to, one, get the resources available to make some of these things happen, but also getting players sitting around the table and talking about what needs to be done.
You mentioned Davidson County and Nashville. Are there other communities, systems that you're looking to learn best practices from?
Yeah, for sure. So actually, Franklin County in Columbus has just recently built a jail. They have, a lot of great strategies and a lot of great programming happening there. But one of the things that really struck us is they have a Good Neighbors program. So it's really essentially a housing unit that is a place where people can, they're in programming most of the day, and they're doing things like life skills, GED, computer literacy, those types of things. But they have a little bit more independence than, maybe a standard housing unit might have. They have opportunity, to cook food, to do their own laundry, to engage in group kind of meditation processes and things like that. And so we would love to be able to incorporate some of those ideas into our facility as well. We also recently went to Bexar County, which is in San Antonio in Texas, and they have a really amazing kind of behavioral health strategy overall in their community. So we're thinking about how to, incorporate some of the pieces around like their crisis center and the way that they use law enforcement and have embedded behavioral health teams on, riding out with their law enforcement.
As you have spent time working with this population, what have you learned that you could apply to other population health initiatives?
I think the most kind of surprising, well, I don't know if it was surprising, but I think the most impactful piece for me over these past 5 years is just the level of need around behavioral health. I think it's about 40% of the people that are in our jail today have a severe persistent mental illness. And it really, begs the question, like, how are we not performing as a community that we have so many people that have so much need and are unstable? We have really great resources, behavioral health resources in the community. And a lot of these folks just don't have behavioral health issues. They also, are homeless, or they, have substance use disorder, or they have a history of, massive history of trauma in their life. And so trying to figure out how, as a community, we can respond better to their needs, I think is going to be really important. A lot of this points back to in the 80s when a lot of behavioral health hospitals were closed, jails became the de facto behavioral health care centers. And I know here in Cuyahoga County, we are the largest, if not the largest, inpatient behavioral health provider in the state. And I think it just speaks to kind of a massive failure of us as a system, that we have people that could otherwise benefit from treatment and case management, peer navigation, and they're just cycling through our jails.
As the plans are coming together for the new jail, how are you approaching visitation? Whether it's family, friends, attorneys, what is currently in the works?
Mm-hmm. That's a hot topic right now, but I will say that Executive Ronaine and myself are very much on the same page, that we are working towards a more humane and kind of just solution for that. Right now, it's limited to video visits, but we are definitely building into our program opportunities for other types of visitation. Security has legitimate and valid concerns about having, interaction between outside visitors and the jail residents. So it is something that we are, that we're going to be having to work towards together, but it's definitely a high priority for us.
So, as you continue to move through your time in this role, what are you starting to define as success? What does that look like for your work?
So I think for sure, making sure that we are, tracking on these goals that we have set. I think reduction in jail population is so key to this work. I think that's, probably one of the biggest measurements that we're going to be looking at. And in other communities we've talked to too, it's not just reducing the jail population, but making sure that people that are, recidivating are not doing it as frequently, right? So if we have a certain level of population that have come into the jail 6 times in the past year, and we can reduce that to 2 times, that should really be a measure of success too. So I think that's, one of the priorities for sure. Looking at different types of programming and getting the programming into the jail even prior to, us moving into the new facility is going to be really important. During the COVID years, there was a massive reduction in the amounts of and types of programming that have been offered inside the facility. And so I think getting back to a place where we can have the types of programming that people need to be, hopefully successful as they leave, but also to give them, something productive to do while they're, awaiting their sentencing or their next step is going to be really important.
Well, Laurel, I mentioned before we start that this was going to go very fast.
Yeah.
So we are thankful for the work that you and Cuyahoga County are doing to try to address the issues that we see with our incarcerated population. And I encourage all of those on the call to stay connected, follow up, and Laurel, please let us know how we can support you in your work.
Thank you so much, Rachel, and thank you for everybody's time today. I did want to give a shout out to Marcia. I saw from the Gun Foundation is on. The Gun Foundation is funding my position, and I just want to recognize that they are so committed to this work, and I really appreciate their support.